Hey guys, do you suffer with runner's knee, patellar tendonitis? Is there a pain just like right underneath your kneecap? Especially when you're active. If that's the case, we're continuing our series on runner's knee and the things that you can do. Now, we always set it up in the same pattern of mobilize, stabilize, stretch. We are now in the stretch. We've covered mobilize, we've covered stabilize, and now we're going to go to the stretch. There are really 4 stretches. We're going to go over all of them right now. They're pretty simple, but it's a real key that you include the stretching. Now, the first one is just a standing squat stretch. Basically, you're going to do like when you were a kid in sports, stand on one leg, grab the other leg as you see here in the video, and you're just going to hold. Now, remember that we're focusing on the patellar tendon, so sometimes you can actually focus depending on the position. You really want to focus on keeping the knee kind of low. You don't necessarily have to pull the leg back as far because you're not trying to get into the hip flexor, you're trying to get into the knee. So just kind of make sure you're extending that foot back as far as you comfortably can. There's going to be a little bit of tension, maybe 2 or 3 out of 10 on the pain scale, but not much, just a nice easy stretch. You're gonna hold this for about 15 to 20 seconds. And then we're gonna repeat the whole round again. You can go through a few rounds if you want to of just the stretching, but usually we'll do the full thing of the mobilize, stabilize, stretch. Okay, then we're gonna go into both a calf stretch, a gastrocnemius and a soleus stretch, a calf stretch. You're gonna start by kind of leaning against the wall, as you see here in the video, lean against the wall, leg back. When your knee is straight, you're stretching the gastrocnemius, the big meatier part of your calf. And you want to have, again, the same type of pressure, maybe 2 to 3 out of 10, not a ton of pressure, but a nice easy stretch. Now with this one, I hold for about 10 seconds. Then after the first 10 seconds, I bend the knee. You'll feel the stretch go further down into the calf, into the soleus, the deeper part, and you're going to hold that for 10 seconds. So we're going to do 10 seconds with the gastrocnemius, the big, and then 10 seconds with the soleus. Okay, then we are going to go into a nice runner's lunge stretch. We do this all the time because it's such a good one. It's a hip flexor stretch, but because the hip and the quad is attached to the patellar tendon, this is going to help with the patellar tendon. So you're going to drop the affected leg that you want to stretch is going to be down on the ground. You're going to lunge forward. Try not to arch your back. This is really when you extend the arm up, and you don't have to extend the arm up, but I like doing this because it just increases the stretch a little. Just make sure you're not arching backwards. There should be a nice, again, 2 to 3 out of 10 on the stretch into the quad, into the hip. And you can actually, if you want, put something under your foot. I don't have it in this video, but because you're focusing on the patellar onto the knee, you can give a little deeper stretch into that by putting something, maybe a foam roller or something under your foot, and that can be a good hip flexor stretch. So now we are complete. Go back, review all of these. We did the mobilize, stabilize, stretch. Do these regularly, do them all the time. Turn your pain into power, turn your weaknesses into strengths. Get rid of that runner's knee. You can do it. See you guys.